Hello, everyone. This is Dr. Clark in the Center for Hormone Health and Wellness. And as you know, we treat people with hormone pellets, both estrogen and testosterone. And these pellets are placed underneath the skin in the subcutaneous tissue. Um, so people often wonder that how are they physically placed in there? Well, it does take a little procedure to do that. The procedure itself takes about 2 minutes for women. For men, it's about 5 minutes. We place them in kind of the buttock, the hip area. And so subsequently, then we just clean off the skin. We place a little bit of numbing medication in there. We make a tiny little incision where the pellets are placed. And subsequently, then you literally walk in to have it done. Go about, you have the procedure done over just a couple of minutes. You leave again, and you just need to take it a little bit easy. That doesn't mean and that means basically that you can do normal everyday things absolutely fine. Just for the first couple of days, we don't want you to be doing anything really strenuous that would work out the glutes very hard. So it does require a little procedure. It's done with a local anesthetic. It takes between 2 and 5 minutes. For females, about 2 minutes, men about 5 minutes. And basically, you come in and go about your day as you normally would, just taking a little bit easy for a couple of days.